conformément à l'article 108 alinéa 2 du règlement adopté par le comité le jeudi 22 octobre 2020.
Motion adopted on Thursday, October 22nd, 2020, the committee is reprising its study of vulnerabilities created and exacerbated by the COVID-19 pandemic.
To mute their microphones when they're not speaking and address comments through the chair. With 30 seconds remaining in questioning or speaking time, I will signal you with this yellow sheet of paper. And you will have interpretation services available through the globe icon at the bottom of your screen. Maintenant, j'aimerais souhaiter la bienvenue à nos témoins du.
Now I'd like to wish a warm welcome to our first panel, Mrs. Roy Pinto, responsible for UNICEF Canada, Taryn Russell, Defense of Rights, and Martin Fisher, Policy Director, Lindsay Gladding, Director, Support to Humanitarian Support for World Vision Canada.
We will give you the chance to lead off for your opening remarks of 5 minutes. If I can just ask witnesses to please watch the timing closely, as there are three organizations that are testifying in limited time. So opening rounds will be 5 minutes, and Ms. Bodma Roy and Ms. Pinto will lead us off. The floor is yours.
Thank you. So thank you for the committee's invitation to contribute to this study and for this focus on children in conflict and crisis. In these contexts, UNICEF and our partners are particularly concerned at the impact of COVID-19 on children's health, mental health, nutrition, education, and protection. These concerns are expressed in our joint 6-point plan. Today, UNICEF will focus on health and nutrition, while our colleagues will speak to the other areas of joint concern. In conflict and crisis settings, the pandemic is adding massive pressures to already overwhelmed health and nutrition systems. Countless families are unable to meet their basic survival needs of food and essential medicines, leaving more children facing malnutrition and deadly disease. Looking at malnutrition, in Northeast Nigeria, more than 4 million people now face acute hunger. In Yemen, over 2 million children are suffering from malnutrition, and in the DRC, we estimate this will be 3 million children this year. This is a combined impact of the pandemic, underlying poverty, displacement, and armed conflict, and in the case of the DRC, also Ebola. Canada's partners can tackle these combined challenges. For example, to reduce the number of people visiting clinics every day in Somalia, UNICEF trained and supplied parents the ability to screen and treat their children for malnutrition at home. This work must continue. Heading into 2021, the year of action on nutrition, Canada's support into nutrition for children in crisis will be essential. Another major concern is access to health. UNICEF applauds Canada's long-standing leadership on global health, from maternal and newborn health to sexual and reproductive health, and significant commitments to the ACT Accelerator. Key to ensure success of these initiatives is vaccine readiness. Countries in conflict and crisis had weakened health systems pre-pandemic and need Canada's support to be ready to deploy COVID-19 vaccines as they become available. This includes helping countries strengthen their cold and supply chains so that they have adequate infrastructure to safely store, transport, and distribute vaccines from the minute they arrive in country to when they are administered into people's arms. It includes training and equipping frontline healthcare workers, the majority of whom are women, whose own right to health must be protected as they support others. And lastly, readiness must include supporting local partners in developing and disseminating localized community engagement strategies to address vaccine misinformation. Simply put, we can't wait for vaccines to reach these countries before we act. Readiness must begin now. And while the focus on COVID-19 vaccines is absolutely necessary, we are increasingly concerned at the potential diversion from life-saving routine immunization, particularly in crisis settings where the needs are high and growing. For example, UNICEF, WHO, and the CDC predict a large-scale measles epidemic in Chad this year without an urgent national measles campaign. In Yemen, close to 40% of infants are not receiving routine vaccinations, and the country is now seeing outbreaks of measles, diphtheria, and other deadly diseases. Like death from malnutrition, these two are preventable deaths. Getting vaccines to children is possible in the pandemic. In Syria, UNICEF and partners helped immunize almost 1 million children since the pandemic started. thanks to adaptations like physical distancing and the use of PPE. Early signs indicate that Canadians are behind us on this issue and are coming to the table to support UNICEF Canada's efforts on vaccines and on other critical areas for children in crisis. There's a real opportunity for Canada to come to the table for children too. First, Canada must stay firm in ensuring contributions to the new COVID-19 commitments do not come at the expense of existing commitments, including health and nutrition. Second, Canada's welcome commitment to increase international assistance must include a clear agenda for children. Recognizing that children do not live siloed lives, Canada's agenda for children must take an integrated approach. Children in crisis cannot access quality education if they are not protected from gender-based violence, child labor, or the mental health impacts of conflict or displacement. Girls cannot advocate for gender equality if they die of preventable diseases or malnutrition. Before and throughout this pandemic, children in crisis have paid too high a price. They are counting on us to act. We look forward to further collaboration with the Government of Canada, our fellow Canadian partners, and Canadians from coast to coast as we work to meet the needs of children in this pandemic. Thank you.
Thank you so much, Ms. Pinto, and thank you for being spot on with respect to timing. We will now turn the floor over to Ms. Levy and Ms. Russell, Aide à l'Enfance Canada. The floor is yours for 5 minutes.
Hi, good afternoon. I'm Taryn Russell, Head of Policy and Advocacy at Save the Children Canada, and I'm here with my colleague Tanika Levy, who's the Humanitarian Advisor. So Save the Children works to address the needs and rights of children in more than 100 countries around the world, including in Canada, and we thank you for inviting us back today to discuss the impact of the pandemic on children. As my colleague from UNICEF outlined, we wanted to coordinate our approach today in order to give you a holistic view on how this pandemic has created a global children's rights crisis and what's needed to respond. So I will be speaking to two intersecting and urgent issues: the global disruptions in education and the rise of gender-based violence. Over 1 billion children's education came to a standstill in the early months of 2020, and most were out of school for 6 months or more. Around 200 million children who were in school before the pandemic remain out of school, and that number continues to fluctuate, as we know well here in Canada. When children are out of school, their learning does not just stop, but is likely to regress. Save the Children did a global survey of 25,000 children and their caregivers and found that 4 out of 5 children felt that they were learning little or nothing at all while out of school. Girls, displaced children, and children living in poor households were most likely to report that they had learned nothing during school closures. So just to give you a sense of some of the challenges that to keep children learning in many contexts, here's a quote from Gwinha, a 12-year-old Syrian girl living in a refugee camp in Lebanon. So she says, "Online education is extremely difficult, and the teachers aren't explaining the lessons well. Since most parents are illiterate, they can't help their children in understanding the lessons. Because of the financial situation, families can't buy stationery or books or devices, and some families have only one phone, so the siblings need to share it, and sometimes the father needs to take it with him to work so the children miss their classes."
Ms. Russell, can I interject just for 30 seconds? Interpretation's asking if you could just slow down a wee bit so they can keep up.
Sorry.
Awesome. Thank you so much.
Sorry,
Thanks.
interpretation. So I feel that her comments really highlight the complexities of implementing distance-based learning measures, particularly for families living in poverty and in crisis situations. So Save the Children has worked to employ innovative solutions to address many of these learning barriers, but it is vital that we get all children back into school as soon as it is safe to do so. And we know the interventions that will be needed. So these include things like financial support for the world's poorest families, catch-up classes for children who re-enter the formal education system, water, sanitation, and hygiene facilities in schools to make them COVID-19 safe, and then national back-to-school communications campaigns to inform communities that it is safe to return to school, and especially those targeted at vulnerable groups, which I mentioned earlier, so including girls, refugees, and internally displaced children. And then finally, effective training for teachers to keep everyone safe during the pandemic. So the closure of schools and the increase in global poverty rates has also exacerbated another critical issue affecting children, that of gender-based violence. To give an example, so in Uganda, despite some schools having reopened, more than 13 million children remain out of school since the end of March last year, including 600,000 refugee children. In Noya district in northern Uganda, figures show that cases of both teenage pregnancies and child marriage doubled, and rates of child labor tripled between April and June last year while children are out of schools. With reporting difficulties, the numbers are likely much higher. Without urgent action, it's projected that over the next 10 years, as many as 13 million additional girls may marry as a result of the pandemic. And we know that this will have immediate as well as lifelong impacts on them, including higher risks to disruptions of their education, life-threatening adolescent pregnancy and childbirth, malnutrition, mental health, and just the inability to control their own future. So Arsima, a young Ethiopian girl whose own child marriage was averted, thankfully, with support from a community safeguarding program, told us, "I couldn't be happier. Now I can study hard and become a doctor." And every child has a right to plan for their own futures in this way. But what's so concerning is that the pandemic is already causing critical interruptions to GBV preventative interventions. So this includes child protection and referral services for girls at risk of GBV, which is how girls like Arsima would have been identified and supported in their communities. So it's clearly a time when governments should be investing in children, their education, and their safety. Yet budgets are being hollowed out by recession and the diversion of public spending to healthcare and economic recovery, which are important. Most of the world's poorest countries, especially in Africa, entered the economic downturn with limited financial space. The international community will be needed to step up and take action to help fill this gap through international aid, but also debt relief measures and providing technical assistance and political support for issues like GBV and education. In our prior testimony, we provided recommendations that Canada should scale up its humanitarian assistance, that Canada should prioritize urgently needed attention to these neglected areas like education and gender-based violence, and that Canada should support calls for a global ceasefire. These recommendations still stand, and I would just echo my colleague that the need for Canada to be championing agenda for children, reflecting their needs as well as their voices into fora both domestic and global when discussing COVID-19 response measures. Children may not be the most directly affected by the virus itself, but as our testimony shows, they are bearing a heavy load of the indirect impacts and need our support. Thank you.
Thank you very much, Ms. Russell. We will now go to World Vision. Mr. Fisher, Ms. Gladding, the floor is yours for 5 minutes.
Thank you very much, Chair and members of the committee, for inviting us to elaborate on our November testimony regarding how COVID-19 is affecting the world's most vulnerable children. I'll be joined in my testimony today by my colleague, Martin Fisher. All 6 agencies that are appearing today have agreed to present different aspects of a comprehensive agenda for children. Our ability to realize the 2030 Agenda for Sustainable Development and lay the groundwork for a better world depends on prioritizing girls and boys, tomorrow's leaders today. 9 years from now, in 2030, it will be a 14-year-old South Sudanese girl and her peers influencing global change, not you or me. So today we want to elaborate by addressing 3 very practical things Canada can do. Number 1, more meaningfully engage girls and boys in our international assistance efforts. Number 2, more closely engage with Canadian and local implementing partners. And number 3, take action to address the increased risks of child labor in our global supply chains. So on increasing children's participation, you don't need me to elaborate on the impacts the pandemic is having on girls and boys. They can tell you themselves. 15-year-old Fleur from Haiti says, "I heard that several girls were raped during the time of the confinement. Even in my neighborhood, a girl was raped and is now pregnant. If there were no confinement and no COVID-19, she would have been in school and she wouldn't be pregnant today." Girls and boys must be part of the solution. 16-year-old Martine from DRC states it plainly. "We want to be able to stand before people and speak about our issues and talk about our rights and dreams." Many of you have youth councils in your own riding. You value young Canadians' opinions and experiences. And so we urge you to intentionally seek out ways to integrate the voices of the world's most vulnerable girls and boys in Canada's response to COVID-19. On more closely engaging with Canadian and local partners, the default for Canada, like most donors, is to heavily and often overly rely on multilateral partners for the delivery of our international assistance. There are simple reasons for this: scale, reputation, time. Don't hear me wrong today. Multilaterals have a critical role to play. And please don't take this as a self-serving plea for more funds. The delivery of international assistance is an interwoven tapestry where civil society from local to global, national government, multilaterals, and donors need to be recognized and equipped to do their part. Canadian partners have incredibly deep roots and long-standing partnerships with local communities, especially in crisis and conflict-affected contexts. We're uniquely positioned to scale up and help. This is even truer for local partners who are often the only ones able to effectively deliver in crisis and conflict-affected regions. Together, we're ready to do more and to work with Global Affairs Canada on the how. We recommend that Global Affairs Canada take concrete steps to enhance the way it engages Canadian and local implementing partners in its response to COVID-19.
Let me conclude then by taking things in a slightly different, albeit very much connected and relevant direction, reducing the risk of children being exploited in global supply chains. COVID-19 is pushing millions of children into exploitive work as families' livelihoods evaporate and poverty increases. Whether boys mining metals for our smartphones in the DRC, girls being sexually exploited on palm oil plantations in Indonesia, or migrant children being enslaved in the Thai seafood industry. This work is seriously compromising their health, safety, and well-being. And there is a clear Canadian connection. In the last months alone, committee members have no doubt seen the media coverage of labor abuses in PPE supply chains. But the problem is much bigger and more pervasive. In fact, tomorrow World Vision is releasing a report revealing that imports of food products at risk of being produced by children was a total of $3.7 billion in 2019. That's a 63% increase over the past decade, and nearly 10% of all foods coming into Canada. We'd be remiss to not expect the companies at the top of these global supply chains to be doing their part, but governments have a key role to play here. Other jurisdictions, including the UK, Australia, France, and the Netherlands, have passed legislation requiring companies to report and take action to prevent child labor and other human rights abuses. In 2018, this very committee tabled a report that recommended the federal government pursue such legislation. Despite initial consultations, Canada has yet to commit or make this a priority. Now, Bill 216 has been introduced in the Senate. But really, why wait on the Senate? If Canada is truly committed to championing a just recovery at home and abroad, common sense legislation like this needs to be part of that. We urge members from all parties to make this legislation a priority. Chair, members of the committee, we've worked with my colleagues here to ensure we provide you with a complementary overview of these impacts. To conclude then, all these issues are linked. That 14-year-old girl in South Sudan experiencing years of conflict and displacement isn't just facing economic uncertainty of food insecurity, increased violence, and isolation. She and millions like her are experiencing this all at once, contributing to a vicious cycle. With the effects of COVID-19 layered on top of already dire situations, the consequences are devastating. Thank you for the opportunity to speak today, and we all look forward to your questions.
I would like to thank all witnesses for their opening remarks and for respecting the time limits carefully. Thank you very much. We will now go to our first round of questions consisting of 6 minutes per member of the committee. And first up is Mr. Morantz. The floor is yours.
Thank you, Mr. Chair. And I want to thank you all for being here virtually speaking. Your work is literally a matter of life and death, and I know all committee members take it very seriously. One of the things I wanted to explore a little more, and the only witness that I recall touching on it was Ms. Pinto, is just the whole situation with vaccines in undeveloped countries and what plans are in place. I know our Prime Minister had promised, had actually committed to sending any vaccine doses that were procured over and above the needs of Canadians to help in undeveloped countries. You know that we're having some difficulty with actually receiving those vaccines at this point. So I'm just wondering if you could share, Ms. Pinto, maybe I'll start with you, your concerns over what does the world need to do to get vaccines in the arms of the most vulnerable people?
Yes, well, I think we already are making some great steps towards making this a reality. I think the global partnership that exists through the COVAX facility is a really great effort to ensure the equitable access to vaccines. And I'm pleased to say that, first of all, Canada has played a huge role in contributing to that. And it's through that facility that they've also promised to eliminate any unused vaccines. But what has happened is that the biggest players that are really already are coming to the table with experience, such as the WHO and Gavi, are key in terms of trying to figure out how to get this across. UNICEF is playing a huge role in this. On a yearly basis, we actually deliver approximately 2 billion doses of routine immunizations to children around the world in some of the most difficult and hard to reach places. So we procure 2 billion doses every year. We are the largest procurer of vaccines. So we've been asked, even though children are not the primary receivers of the COVID-19 vaccine, to really help in terms of procurement, in terms of logistics, supply management, transportation, all of vaccine readiness, which I spoke to in my opening remarks. And it really does speak to the fact that, at this point, we can't really help children the way we need to help children unless we also get rid of the pandemic. So this is going to be a big thing. We've actually just hot off the presses have the first 18 countries in the developing world that will be getting the vaccine. Unfortunately, I can't share which ones those are with you. They will be announced officially tomorrow in a press conference. The first step is really vaccine readiness.
Okay, can you tell us who they are? Just kidding.
Yeah, sorry. I would get in big trouble. Sorry.
No, I'm just kidding. Just in terms of Canada's role or what Canada can do, I mentioned that the Prime Minister had made a commitment to providing excess doses. Has your organization received any assurances, written or verbal, from the Canadian government with respect to the provision of vaccines?
Again, this is all being coordinated through the COVAX facility, of which our global UNICEF is part of. I know that landscape is constantly changing, but we do know that there's actually been a lot of funds that have already been injected by Canada into not only the vaccines and to procure and purchase vaccines, but also the purchase of therapeutics, et cetera. So right now, Canada is playing a leadership role, and as are other major countries and foundations. It really is a global effort and really speaks to the strength of multilateral cooperation in this case.
Thank you for that. And with respect to COVAX, I had a meeting actually with someone from Doctors Without Borders a couple of days ago, and I asked about this, and there were some serious concerns about the COVAX program and how it's being rolled out. Have you been hearing those things as well, or is it all going well, or are there issues?
I think it's, like I said, it's constantly moving target. As you know, the whole vaccine landscape is constantly changing. Which vaccines will be available where. I mean, it's actually, if you can imagine, and I'm sure this is not surprising, an incredibly complex process. When you're talking about vaccine readiness, you're talking also about ensuring that there are cold chain in place, supply chains, that certain countries, certain vaccines might work more effectively, or just based on their infrastructure. So there's a lot going on. I don't think we have all the information. I think that might be part of the frustration, is that all of the information in terms of how exactly this will all roll out is, as complicated as what we hear here in Canada. Very similar. The time is constantly changing.
Just one quick last one, if I may, Mr. Chair. I think one of the witnesses, and I don't recall which one, expressed some concerns over Canada's percentage of GNI going to international development. I just can't recall who it was, but I'm wondering if that witness could expand on those concerns.
Just very briefly, please.
No one? Well, maybe just generally then, does anyone have a view on that?
I can jump in. I don't think I said it specifically, but I think the case that we're trying to make as civil society in Canada is that it's unprecedented times, and we have the opportunity to not only stop the scaling back of a lot of progress that we've made in areas across health, education, and other issues, but also address the global pandemic, and that the resources needed are higher than what we're currently providing. So there's a
Thank
lot
you
of
so much.
opportunity for investment.
Thank you very much, Ms. Russell. Mr. Morantz, we'll have to leave it there. We'll now go to Dr. Fry again for 6 minutes, please.
Thank you very much, Chair, and thank you so much to the witnesses, because you are highlighting something that has been going on for a very long time, and most countries in the world have not paid a lot of attention, especially to displaced children. And what we know, there are 33 million displaced children globally right now, and all of the things that you say are happening. I mean, COVID has exposed it. The thing about it is, though, as you actually said, COVID, they're not getting COVID. That's not the issue. The issue is nutrition, sanitation, access to food, access to healthcare, access to education, and more importantly, the sexual slavery and the labor slavery that we see going on with these kids being exploited and or disappearing. Now, I know when we talk about this, we talk a lot about Africa, and we talk a lot about the Middle East, and we talk a lot about those kinds of conflict zones. But actually, this is a humongous issue in Europe. Children, displaced children in camps are not getting any help, are not even seen, are not heard, are disappearing. And I think COVID has exacerbated this, and I'm hoping that we're not just going to look at what the impact of COVID is, but that COVID would have given us the opportunity to actually begin to understand this issue and the lost generations that are going to come as a result of conflict and displacement for children around the world. So my question is simply this. How can, I know Canada is interested, Canada is with COVAX, Canada is doing all of these things, but how do we get countries of the world to actually pay attention to displaced children? UNICEF, you did a survey in 2020 that said 159 countries were surveyed, and it showed that the displaced children are excluded from national pandemic responses, from strategies, from recovery plans. They're not even documented. Nobody knows who they are, where they are in so many places. And so what are the essential services that we need to do, and how do we get migrant children? And I'm really concerned about migrant children. How do we get migrant children the help, the care, the documentation we need? And secondly, what are the factors you think that have contributed to the plight of migrant children and the fact that most nations have ignored their plight, and we just tend to look at kids in conflict zones who are actually in the conflict zones and not the ones who have been displaced and trying to migrate? So what are the things you need to do? I would like some real recommendations to get this on the agenda and to make sure that countries continue to look at this even after COVID has gone away. I don't know who wants to start, but I think maybe UNICEF, because you did the survey.
Annie, do you want to take this one?
Yeah, sure. Thanks so much for that question and for the focus on refugee and displaced children. I think one of the first steps is one that was articulated by colleagues from World Vision, which is really listening to children and young people themselves. All of our organizations do work directly with refugee and displaced children and youth who have told us over and over again what their needs are. And some of those needs are, in fact, in areas that are chronically underfunded. If we are to listen to displaced and refugee young children and young people and children, they will tell you that their needs that they prioritize over anything else are education and protection. And these are areas that in emergencies are chronically underfunded. So a first step would be to listen to children and young people themselves. What are they saying they need? What is the most important thing to them? That is a critical first step. And then to take action based on what they are saying. When Canada is looking at its international response to COVID, but also longer term recovery, how can we ensure an inclusive recovery that really looks at supporting the refugee and displaced youth in what they are saying that they need, not just today, but over the longer term?
I just wanted to quickly flag when I'm asking this question. I am trying to find out, how do we keep track of those kids? How do we identify them? How do we make sure that they are on the radar? Because talking to them is one thing. You've got to be able to pay attention to them. And I know specifically in Europe, Many countries have just kind of ignored them, locked them down, seen them as a nuisance, and are not paying attention to them during the pandemic. And I think this is what I'm trying to get at. How do we document where they are, who they are, when they are? How do we make them real people? They're invisible right now.
Yeah, I can jump in. I think that it is quite a problem. Not every country has robust data collection systems to be able to be tracking at the level that we would want the numbers of displaced boys and girls. But the fact is that the majority of refugee children, are hosted in low and middle income countries. So if Canada is serious about getting this type of information and getting the supports that are needed to these children, then support for these types of contexts needs to increase. Those countries that have more flexible and more welcoming policies for refugees, such as Uganda, should be rewarded for that, quote unquote, with the aid and the additional supports that they need so that refugee and displaced children can be included in national systems. But frankly, that level of support that's needed to support that inclusion is not available, even in contexts where policies are more welcoming.
Thank you so much. That's your time, Dr. Fry. Thank you very much. Thank you, Ms. Levy. Maintenant, la parole est à Monsieur Bergeron pour 6 minutes, s'il vous plaît.
Mr. Bergeron, 6 minutes. Thank you, Mr. Chair. I would like to thank our witnesses. Thank you for your presentations. This was very important for the committee's work. We know that the situation of children in conflict or crisis situations is really problematic, and that this has multiple facets. We're realizing more and more that this is exacerbated by the COVID situation right now. We know that children are less affected by COVID itself than older people are, but we also know that in crisis or situations or in war zones, children have other factors. For example, malnutrition, lack of care. And so this worsens the effects of COVID-19. This being said, we also know that the vaccines currently available, well, some of them require storage at extremely low temperatures. So this makes it extremely complicated to administer vaccines. In the meantime, we hope that people will be able to respect the hygiene measures to avoid infection by the virus. According to a UNICEF study, 40% of the world population doesn't have the installations to wash one's hand with soap and water. So one of the first things that we've been hearing is that we should frequently wash our hands using fresh water and using soap. So we see that in many cases here, the situation is such that it's not even possible. So how can we ensure adequate access to safe drinking water? Normally, this is an issue. It's an issue for populations living in a crisis zone or a war zone, but it's becoming increasingly so with COVID-19 and this crisis. That is complicating things further.
I can take that question, and then if colleagues want to jump in as well. Merci beaucoup pour la question. Je vais répondre en anglais.
Thank you.
At the outset, a 6-point plan for children. And in fact, one of those priorities is in fact to ensure an increased access to clean water, sanitation, and hygiene for children and young people all over the world. As you mentioned, 40% of people in some of these contexts don't have access to clean water. One of the concerns that UNICEF has, and as well as other partners, is
specifically for children in crowded conditions like we see in refugee camps and displacement camps. And so one area of focus for us is very much to ensure increased access in those conditions. That includes clean water as well as access to soap and access to water purification tablets. So that's one measure that's a high priority for us, particularly looking in the context of this segment on children in conflict and crisis situations.
Et avez-vous, pardon, allez-y.
Merci.
Thank you. I'll answer in English as well.
The one thing that Rowena talked about in terms of vaccines is the massive logistical challenge that we face in many of these countries. And I think we'd be remiss if we didn't point to the massive public awareness effort that needs to go in parallel to that. Because we know this from our work that there's misconceptions about vaccines, that there's worries about vaccines, that often the information trickles down to the communities that we work in very slowly. So I think if we isolate the conversation about vaccines to a logistical challenge in developing countries, probably we're only covering one side of the story. I think equally, and we know that when it comes to children, then we will only be able to provide the kind of protection services and the kind of health services if their parents are able to go back to work once they're vaccinated. So I think it's really important to look at this, as we had said, sort of holistically, and to not isolate vaccines as a silver bullet, and to look at the way that we will be able to actually get people to be willing to become vaccinated once those are available.
Alors, s'il n'y a pas d'autres témoins qui sont...
So if no one else wants to intervene, you are speaking to raising awareness and saying that this is an essential step in a vaccination campaign such as that that is required during this COVID-19 crisis. And one of the vectors to raise awareness, one of the most important ways, is education. And we see this even in ideal, in situations, for example, in Quebec or Canada, the level of interest is very low because of distance learning, virtual learning. And in countries where virtual learning or even basic education is extremely logistically complex, how can we overcome this challenge, especially in this context of COVID-19?
Back in the second round.
So perhaps I can jump in here. I mean, I think certainly from my perspective, and one of the important things that we need to do first is to understand contextually what the barriers are. And so World Vision has conducted a recent barrier analysis to vaccine uptake in Myanmar, Bangladesh, Kenya, Tanzania, and DRC, and is using that to help national governments, national public health efforts to understand why people may be unable or unwilling to access vaccines, to access healthcare, so that we can very intentionally address those barriers.
I apologize. I think we'll have to leave it there in the interest of fairness and time. Maybe a chance to come back to this point when Monsieur Bergeron has a second chance to ask. We will now go to Ms. McPherson for 6 minutes, please.
Thank you, Mr. Chair, and I want to thank all of our witnesses today for coming and sharing with us. I know next week is International Development Week, so if I don't get a chance to see you during the week, I just want to thank you deeply from the bottom of my heart for all of the work that you do. And next week, as we celebrate your efforts, we'll keep you in mind. I would be remiss. I mean, this committee knows I'm very committed to increasing Canada's official development assistance. I think that it's embarrassingly low right now, and I think we heard from the witnesses today that during COVID-19, it's vitally important that Canada's contribution and Canada's commitment be in addition to, not instead of our overseas official development assistance. So I do have some questions about what could be accomplished if our ODA was appropriate, and I think it's important that we do get this on the record. Could you, maybe I'll start with Ms. Russell, could you talk a little bit about, you spoke of the risks that girls will not return to school, that we will lose some of those gains we've made in terms of girls' enrollment in school. What could be done if we were able to do more to prevent that loss of enrollment as we come out of the COVID-19 pandemic?
Sure, I can start, and my colleague Tanika might want to jump in as well. I mean, I think that's the thing the first thing is that by enabling us to increase our efforts, we'll be able to ensure not only that all kids that were in school, including girls in those vulnerable groups before the pandemic, are able to return, but also that we can pick up the great work that was happening around getting more students in school generally. Over the past couple of decades, we've made a lot of global progress, including in really complex situations like Afghanistan, in terms of getting girls in school at the same levels of boys in many places, and really reducing that gap. And there is a real risk that we're going to backslide on a lot of the progress made. And then we know that all the knock-on effects of schooling that it has. I mean, you've heard this before. It's not just a place to learn. It's a place where children flee violence, where we're able to deliver immunization programs in many cases, and malnutrition. We have done, we know the interventions that work. A lot of the organizations here are utilizing them. It's just the scale that needs more effort put into it. We did some analysis at Save the Children that it would require $50 billion worldwide to get all kids back in school that are out of school right now. And that's not just donors, that's national governments prioritizing it in their budget. So it needs to be an all-in effort in terms of how are we using our political will to really prioritize these efforts.
And to ensure that those dollars are there, absolutely.
Exactly.
And I think one of the things that I hear from this too is that there is that opportunity with the backslide to lose those gains. So the investment we've already put into women and girls around the world could be lost. And when you speak of of situations in places like Afghanistan, I completely agree. I'm going to ask Ms. Pinto the next question, if I could, in terms of our vaccine outreach and in terms of making sure that people around the world are able to recover equitably from COVID-19 as we go forward. So I'm gonna quote a survey that was actually done by World Vision and Abacus Data that actually talked about how 78% of Canadians think that the government of Canada needs to increase the amount of money it spends on development assistance, focused on helping those that are displaced or in refugee camps impacted by COVID-19. Perhaps either Ms. Bodmer-Roy or Ms. Pinto, you could speak a little bit about how Canada, what an increased contribution would mean and how Canada could do more around making sure that there is an equitable rollout of the vaccine, that there is an equitable response to COVID-19 around the world.
Okay, thanks for that question. I think around vaccines, I think, as I've mentioned, right now, Canada is playing a big role. I think obviously this can always be increased. There's obviously this problem is as complex as we see here just in Canada. So you can only imagine that as we get into it and the vaccines start to flow, especially to the developing world, and we're going to run up against barriers very similar to what we're having here. Investment requirements will change. We'll have to be very agile and flexible in terms of our approaches on this. As you know, someone just mentioned was there, the number of vaccines and how you store them, how you transport them, how you deliver them, the amount of doses, all of those things are constantly moving targets. And so we don't have all the answers right now. Even the price of vaccines is a constantly changing landscape. What we do know is that we are starting to look at what it will actually take to deliver the vaccines effectively. That's does not count in terms of the actual purchase of the vaccines, but just to get them into the arms of people. Having vaccines is one step. So, and of course, as you mentioned, people who are in conflict settings or in displaced camps, that will be a much bigger cost. So I think Canada has a huge role to play on that.
Thank you.
Sorry to interrupt you. I'm running out of time, and I had one really quick question, and it's not a quick question, but I don't have very much time. I was going to ask Mr. Fisher if he could speak a little bit more about the supply chain legislation and why he thinks that we have not moved forward on the supply chain legislation that was recommended 2 years ago to the government.
Thanks, I'm conscious of time. I can give you a very quick answer.
I could come back in my next section too for you.
Sure, but I can start by saying there really is we have a hard time seeing anything but a lack of political will as a reason, because there's recommendation over recommendation. There's we realize that COVID set back some of the momentum that we saw in Canada, but as we really look into 2021 and 2022, I have a hard time seeing what else we need to do other than for the government to pick up that great progress and indicate that they're willing to do it.
Thanks very much, Mr. Fisher. Thank you, Ms.
answer.
McPherson.
Thanks.
We will now go into our second round of questions. I just encourage colleagues to continue to respect the time limits carefully, because there are some very tight allocations. I want to make sure that a member of each party has a chance to ask a second question in this second round. The first 5 minutes go to Mr. Genuis.
Well, thank you so much to all the witnesses for your work and for your testimony. At risk of looking like I'm trying to give Ms. McPherson some of my time for free, I did want to just follow up with Mr. Fisher and give you a bit more time on that. And maybe just a comment to you, first of all. The Subcommittee on International Human Rights did some extensive work on the situation of Uyghurs, and supply chain legislation was a key part of that discussion. There were some very strong all-party recommendations in a statement that was released. So although the government hasn't taken action on this, I think you see strong political will from at least everyday members of all parties. And so I don't know how we cross that threshold when we have members of all parties, our party, but others as well, pushing on this. And the reality is Senate bills, private members bills, it's just huge delays. Like I've been working on a fairly simple organ harvesting and trafficking bill that everybody supports, and people have been trying to get this passed for 10 years, and it's just delays and procedural issues, which is why basically, unfortunately, you kind of need a government bill to get things done in a timely way around here. Did you have a comment on that or any feedback? And then I'll go to my next question.
Thanks for giving me a bit more time. I think you're right. I mean, and when I say political will, I really mean a strong signal from the federal government that this is a priority, that they're willing to move on it based on various consensus, as you indicated. We know that members of the opposition parties are in favor of this. We actually know that in private, members of the government are in favor of this. And in part, the move to the Senate was, you're right, procedural, to make sure that it actually gets some airtime. We also, and I know that some members here are active when it comes to petitions. We have a petition that has 70,000 signatures on the issue. And really, when we look at public awareness, and I think there's various pieces that have come out over the last few weeks that highlight the PPE risks, and you're right, Mr. Genuis, around the Uyghurs, that is a concern. We saw a quick response actually from the government together with the UK when it comes to the Uyghurs. Whether that's strong enough, one can debate, but there was sort of a tactical response and say we will ban those imports. So apparently it is doable.
Yeah, sorry, I do want to get another question, but thank you for that. Maybe Ms. McPherson can pick up on it further. I'm certainly of the view that the government's response was not adequate, and it was a quick communications response. But I think, and again, at least in private, I suspect many members of the government would agree that more needs to be done. An open-ended question for anyone who wants to ask it. I'm very interested in us exploring more the role of conflict in undermining development. And I think one of the other issues when it comes to education is what are the opportunities in an educational setting for students perhaps across conflicting communities to interact with each other, for pro-pluralism messages to be communicated as part of education, and the losses in terms of that interaction that come with people being out of school. So if anybody wants to pick up on that, the role of conflict, pluralism, and what we're seeing right now.
Yeah, I think you're certainly right. Education is a huge vehicle for peace building. And although there are challenges, undoubtedly with the pandemic, with school closures, preventing children from accessing physical classrooms, there are in fact a lot of low cost and low tech modalities that can be launched, and that all of our agencies have been using with great success and with efficacy. Simple things like paper-based methodologies, take-home learning packets, things like that, in which gender transformative messages around peace building, messages around safety and hygiene to protect children and their families in the context of the pandemic can be embedded. So these types of things, they're really quite necessary. It does take resourcing to be able to implement these things at scale as well, to train teachers in the use of these modalities. So yeah, I hope that answers your question.
Thank you. Thank you. 15 seconds. Anyone else want to weigh in?
I'll weigh in just to say quickly too that when we're looking at conflict contexts and the displacement that results often from conflict, it's important that when we're designing education programs that we're looking at the displaced populations as well as host communities, and whether that's in the context of internal displacement and host communities within a country or cross-border and host communities for refugees, that we're really trying to ensure that there isn't a one versus the other approach, and that we're not, for example, providing education for one group at the expense of another group, and likewise for other types of interventions such as immunization or nutrition or protection.
Thank you so much. Thank you, Mr. Generous. Thank you, Mrs. Bodnar-Roy. We'll now go to the next speaker, Ms. Sahota, please, for 5 minutes.
Thank you. My questions are for UNICEF and Ms. Bodnar-Roy. You've mentioned the importance of vaccine readiness as a part of Canada's global response to ending COVID-19. We've talked about, why it's needed, where it's needed, when it's needed, and all of that. But can you speak to how vaccine readiness would be in line with the government's feminist international assistance policy?
Thank you for the question. We know, and many people have spoken today, that women and girls are disproportionately impacted by COVID-19, and I know later on we'll hear from other colleagues further on some of those issues. We know that gender equality is also one of the inequalities that has been exacerbated in this pandemic. So, for example, the health of women is adversely impacted through reallocation of resources and priorities, including sexual and reproductive health services and maternal health services. We know that unpaid care work has increased. We know that, for example, particularly with children out of school, and I can attest to that as a working mother here in Canada, that there have been challenges, and those challenges are reflected around the world. But at the same time, in many contexts, including in conflict and crisis contexts, the responsibility for ensuring children get vaccinated falls on women, on mothers, on grandmothers, on aunts, on older sisters sometimes. And so as Canada looks to support vaccine readiness, there must be a specific effort to empower and equip women really to look at vaccine misinformation. So really ensuring that women, whether it's mothers or grandmothers or women's associations at community level, that they have the information to really fight vaccine misinformation at community level, and ensure that too, when looking at equitable access to COVID-19 vaccines, that local women's organizations and networks, again, at that community level, are consulted to ensure that COVID-19 vaccines reach the most vulnerable, and that's a critical part of readiness. The other element I would highlight too is that it's estimated that 70% of frontline health workers in these contexts are women. And so this means that many women will be taking responsibility to safely distribute and administer COVID-19 vaccines. So these health workers are putting themselves on the front line of COVID-19 distribution, and they must be protected through adequate training, and also, for example, on vaccine storage, on cold chains, on distribution and administration, and also ensuring that they're equipped with PPE. They also, too, need to be provided priority access to COVID-19 themselves, so that as they're protecting other people's right to health, their own health is protected.
Okay. How many minutes do I have? Do I have 2 minutes? Mr.
Yes,
Chair?
you've just got over 2 minutes. Yes, Ms.
Okay.
Hoda.
I was also wondering if you can follow up on your 6-point plan and expand on that plan for children.
Thank you. So I mentioned just earlier in response to Monsieur Bergeron, the focus on water and sanitation. But so maybe I'll spend some time focusing on the other 5 areas of the 6-point plan, just to highlight that these are a set of practical and concrete actions to really reunite the world around a common cause, and that is the realization of the SDGs and the Convention on the Rights of the Child. So the 6 priorities I mentioned, water and sanitation, but there are other ones that have been highlighted here today. So there is the priority on education to ensure that all children learn, and that includes provision of targeted education support for children in conflict and crisis, including displaced children, as well as girls and children with disabilities. To guarantee equitable access to health and nutrition services, including making sure that vaccines are affordable and available to every child. And I would really highlight the importance of ensuring we don't forget about routine vaccinations. We are very concerned that measles and polio and diphtheria, other deadly diseases, are really increasing now in conflict-affected countries in particular, like Yemen, as my colleague highlighted. So that's another priority. We're also concerned about the mental health of children and young people, and that's the 3rd area, and bringing an end to abuse and gender-based violence. So recognizing too that gender-based violence has severe mental health impacts. So that's our 3rd area, is mental health and gender-based violence. Water and sanitation is the 4th. There's also a concern around increases in child poverty, and really there we needed to focus on inclusive recovery for all, including through an increase to overseas aid commitments and social protection mechanisms like cash transfers to allow children access to education, nutrition services, and immunization. And then finally, and this is really, I would say, one of the most relevant to this segment of the study, is redouble efforts to protect and support children and their families living through conflict, disaster, and displacement.
Thank you so much, Ms. Hoda, Ms. Bonneroy. Thank you. Monsieur Bergeron, 2 minutes et demie, s'il vous plaît.
2.5 minutes, Mr. Bergeron. Thank you. I'm going to continue with this question of teaching. UNESCO believes that the great majority of schools last year were closed. During 14 weeks on average, these mandatory closures had an impact on 90% of students, and many are still affected by this closure. So this de-scholarization, if I can say it, has an impact on industrialized countries as well, where we see that the dropout rate due to lack of interest by students risks to be on the rise, even with all these technologies. So what are the risks and effects of this situation in countries under development, and especially in conflict zones? We had already begun to answer this question, so perhaps can we continue with an answer?
Yeah, I can jump in. So as you mentioned, there's been a huge amount of children that have been out of school, over 1 billion. There remains hundreds of millions of children that are in and out of school, and that number keeps changing. And I would say it's because of the pandemic, but also in conflict situations, we have to think if there's other reasons too. So violence against schools has been a huge issue in the past year. We've seen instances of schools under attack in countries like Iraq and Afghanistan. Afghanistan right now, schools are closed because of the winter, and so that compounds the issue because many families rely on schools to keep their children warm during the day, and so we're struggling there. So it's COVID compounded with conflict, compounded with natural disasters, and other issues that are really forcing this learning crisis. And so, as I mentioned, I think what's going to need to happen, especially for these vulnerable groups, which we know who they are, they're girls, they're children with disabilities who were out of school at alarmingly high rates before the pandemic, and they're refugees and internally displaced children, and they need really targeted supports because it's going to be harder than ever to get them back in school after the pandemic, because many of them have already fallen victim to harmful practices, and that can be anything from child marriage, which I spoke about at length, but it can also include child labor, trafficking, families that are too poor and their children go back to work. So many things like that. So I think it's going to require a real concerted effort in talking to communities about what they need to support their vulnerable groups in terms of getting them back in school once it's safe to do so.
Merci beaucoup, Monsieur Bergeron. Exactement 2 minutes et demie, merci. And our final questioner will be Ms. McPherson, also for 2.5 minutes, please.
Thank you again, Mr. Chair. I would like to ask a question of the Save the Children Canada and World Vision Canada teams. So we know how important it is, the work that multilaterals do, and how vital that is. However, we also know that Canadian CSOs, local CSOs, Canadian CSOs from all sizes, both large and small, medium organizations, often have a closer relationship with the community, are often more nimble and able to turn their programming much more appropriately. I wonder if both organizations could speak very briefly about whether or not they feel Canada should be directing more aid dollars towards the Canadian CSO community and local CSO community. Perhaps I could start with Ms. Gladding.
Sure, thanks. I was just looking for the mute button. Yeah, appreciate the question. I mean, I think there is definitely room for Canada to increase its support to Canadian civil society and particularly to local organizations. We know that these are the players that are at the front lines, that are providing services to communities, who are influential in the communities. And so, we have done a significant amount of work with faith leaders, and we know that the word of a faith leader carries a lot of weight. And so when we're talking about barriers to vaccine access or misinformation about COVID-19, the role of faith leaders and the role of local actors and being able to combat that, it really can't be underestimated or overestimated. So Canada, has an opportunity to invest in that front line, and in doing so with Canadian partners.
Thank you. Ms. Russell?
Yeah, I would just add, I mean, Canada should invest where it's going to have the most impact. And where that's proven that it's going to, multilaterals can have really fantastic impact when it comes to delivering on scale. For example, we see Gavi with vaccines, Global Fund, and the great work they're doing around HIV, AIDS, TB, and malaria. But what we don't want to see is funds not flowing through smaller organizations or medium-sized organizations because there's barriers to doing so, not because it's an issue around impact. So I think what we want to ensure is that there's mechanisms that set up that make it easier for global affairs to make decisions in terms of where's funding going to flow, based on kind of who's going to benefit the most from that, from many of the ways that Lindsay just reiterated around our close list with local leaders and smaller civil society organizations in country and all those reasons.
Thank you.
Thank you so much, Ms. McPherson. And that takes us to the end of our scheduled time with panel one. On our collective behalf, I'd like to thank our panelists for their testimony, for their expertise, and most importantly, for their service. Merci beaucoup de votre service.
Thank you kindly for your service.
And briefly to allow our second panel to come on board and then resume. Madam Clerk. welcome our witnesses for the second panel. Just for the benefit of those who've joined us, I would encourage all participants to mute their microphones when they're not speaking. Direct your comments through the chair, please. Lorsqu'il vous restera 30 secondes de votre temps de parole, je vous...
When you'll have 30...
sont disponibles à travers l'icône.
Interpretation services are available by clicking on the globe at the bottom of your screen.
Tanjina Mirza, Chief Programs Officer of Plan International Canada, who is with us. Annalisa Bruzzati, Senior Technical Advisor for Child Protection of the International Rescue Committee. Susan McIsaac, President and Chief Executive Officer, and Ilyas Ayub, Global Director, Country Operations with Right to Play International. Ms. Mirza, welcome back to the committee. We will have you start off with introductory remarks of 5 minutes, please.
So thank you so much for giving this opportunity to speak with you again. COVID-19 is a child rights issue, and the challenge is staggering, and the situation is getting worse. So it's wonderful to talk about all of these issues, and thank you for inviting us again. So as you heard from in the previous panel, Plan International is a leading, and along with other leading child rights organizations, we are united in working together to address this crisis. And as I mentioned in last November, Plan International is one of the largest child rights organizations in international development, striving to end gender inequality and promote child rights. We work in the context heavily burdened by crisis and conflict. So today what I'm going to do is I'm going to focus on what we have learned over the last 10 months that have increased the vulnerabilities of children, especially girls, during COVID-19. And I would also like to give some pointers on what we are doing right now to respond to this crisis. So first of all, let me provide you on what we have learned in the last 10 months, especially for children who are most vulnerable and those who are girls, especially in the conflict and displacement setting, and with regards to their health, education, food security, and income poverty. So over the last 10 months, we have 7 points that we are we are seeing very closely. Is number one, the school closure. So safely returning children to school, especially the girls. This is vital in protecting their immediate and long-term health and well-being and their educational opportunities. Education window is a small window, and if we lose that, it's a very significant loss for the children's future as well as their current lives. 75 million children, predominantly girls, are out of school in 35 countries right now. The second point, violence against children and women has surged, and it requires strategies to improving reporting, raising awareness, psychological care, and victim services. Violence against children is impacting all aspects of their survival, physical and mental health, and of course, by 2030, it is estimated that 13 million more girls will be entering into early child and forced marriage. The third point, girls and women are suffering economic loss and income and social protection during this pandemic, making it even more crucial to promote initiatives and policies that enable girls to remain in school and or in training so that they're ready for future income generation activity. Girls are also experiencing greater barriers to essential sexual and reproductive health services. As the health systems are grappling with providing COVID-19 services, this service of sexual and reproductive health is not being prioritized, and it needs urgent attention. Another area that we are seeing is the food insecurity, and there are growing risks of famine in many parts of the world, and it's directly a result of pandemic. As we know, COVID is not impacting the children directly, but these are the impacts that they're facing because of the COVID pandemic globally. And lastly, but not the least, is the need to invest in health system globally, especially at the primary healthcare level. More than 80% of the world's refugees are hosted in low and middle-income countries where health systems are not equipped even in day-to-day work, and now with COVID and disease outbreak, it's becoming a huge concern. So now, how are we responding to the crisis in Plan International Canada? So Plan International Canada has adapted all its programs to adjust to COVID-19 reality. We are leaders in our approach to integrate gender equality in all aspects such as health, education, economic empowerment, impacts of climate change, food security, water, and sanitation, and all focusing on children and especially girls. We are investing in a big way on gender responsive health system strengthening so that not only can they respond to COVID-19 now, but they're resilient for future pandemics. Our gender responsive approach includes prevention and protection measures, continuity of essential, essential services, access to education and gender-based violence, so that they can prevent child marriage. We are providing life-saving acute food insecure to the food assistance to the food insecure population. And last but not the least, we are making sure, the education programs are effective even during the COVID-19 closure. So we look forward to the launch of the Together for Education campaign next week for displaced children. So inclusion, moving past this pandemic, requires unprecedented collaboration and solidarity among all organizations, countries, the government, and NGO sector. We are encouraged by Canadians' international response to the pandemic and consistent commitment to increase Canada's official development assistance. We will remain as Plan International Canada to support the urgent needs of girls and children across all the crisis-affected countries. Thank you so
Ms.
much.
Mirza, thank you very much for your opening remarks. We will now turn to Ms. Brazzati. The floor is yours for 5 minutes, please.
Thank you to the House of Commons for inviting the International Rescue Committee to testify today and for convening this meeting. We are proud to join the other 5 organizations testifying and call attention to the need for a comprehensive agenda for children, particularly those living in humanitarian contexts. We all know that this moment, as we collectively live through an unprecedented global pandemic, is having particular and troubling impacts on children. We have seen the impacts firsthand on our children. We have had to homeschool while being concerned about our own livelihoods. We have worried about children we know getting sick or experiencing anxiety. We worry about what effect this time will have on their futures. In the 40 countries where the IRC works, COVID-19 did not create these types of challenges. It only deepened them. Children living in conflict and crisis have always dealt with school closures and the burden, stress, and trauma of living in uncertainty. Children who have been displaced do not even have the comfort of a home. COVID-19 and the containment measures have layered risk upon risk for these children. Learning loss, poor nutrition, school dropout, extreme poverty, social isolation, mental health consequences, and drastic increases in the risk of violence within and outside their homes. All of this, while it is more difficult for organizations like the IRC to deliver services or identify children who need our assistance. Child protection professionals who rely on educators and communities to recognize signs of violence against children are finding that traditional entry points to services and support are disrupted, making it harder to identify children in need and reach them with the life-saving services. Even as schools reopen, UNESCO warns that 24 million children and youth may not return to the classroom. These losses are personal, as each child deserves an opportunity for a future, as well as collective. The World Bank estimates that learning losses due to COVID could add up to $10 trillion US. Girls, already up to 90% more likely not to attend school than their male counterparts in conflict settings, are at particular risk not to return due to persistent gender inequality. Children of all ages face particular risks. The early years are vital for brain development and setting children on a path to success in primary schools. They are foundational to productivity and well-being. Adolescence is another critical stage for brain development as children prepare for adulthood. And yet, in South Sudan, adolescent girls are 3 times more likely to die in childbirth than to complete their education. Despite all of this knowledge, there is limited actual commitment to prioritize and fund protective services. Child protection services made up only 1.4% of total funding received in 19 humanitarian responses in 2019. The Moving Minds Alliance found that early childhood development funding in crisis-affected countries represented only 2% of the share of humanitarian aid in 2018. This was before COVID increased competing priorities. The University of Virginia and Sesame Workshop found that the most drastically underrepresented areas of COVID global humanitarian response plan appeals included children's safety, security, responsive caregiving, and early learning. Canada, as a leader in the humanitarian sector, can and should strengthen inclusion of holistic services for children and families in both standing humanitarian crises and crises deepened by the impact of COVID. This means translating what we know about the importance of interventions during childhood into policy priorities and increased investments. We echo our colleagues' calls to achieve the increase in ODA to which Canada has committed. We recommend increasing the share of funding to child protection, so responses can prioritize protection from abuse and violence in and out of the home and support child development and well-being. These interventions must start in pregnancy and continue throughout the life cycle for children and youth. We support and call on Canada to support the Global Learning Together 6-point plan of action and emphasize particularly mental health and well-being for children, caregivers, and teachers, addressing how gender inequality impacts education, and particularly during COVID, lessening the digital divide, creating flexible alternatives that can allow children to safely interact with peers and learn. Immediate and long-term opportunities exist for Canada to show leadership for children. These include adequately funding and maximizing the work of the soon-to-be-launched Refugee Education Campaign and using the G7 meetings and Global Partnership for Education Replenishment as opportunities to demonstrate Canada's commitment to leadership to support children in humanitarian contexts. The truth is, children cannot wait. Each day without increased actions means more young girls married, more boys leaving school for work, and isolated children facing violence alone. Each week without mental health services increases the stress on children and parents, and each month out of school increases the likelihood of lost economic opportunities in the future. Once more, the IRC commends the House of Commons on holding this meeting and its commitment to strong, actionable solutions for children. So we stand by ready to partner and support in the future direction. Thank you very much.
Thank you so much, Ms. Brazotti, for your opening remarks. And the final set of opening remarks goes to Ms. McIsaac and Mr. Ayub, Right to Play International, also for 5 minutes, please.
Sorry, I was on mute. Good afternoon and thank you, Chair. At Right to Play International, our mission is to protect, educate, and empower children to rise above adversity using the power of play. I'm hoping that I will be joined by my colleague Elias shortly. Together, we thank you for the invitation and for your attention to this very critical issue. We have been encouraged by Canada's COVID-19 response and its recent commitment to increase ODA investments to support global recovery efforts. Our hope is that this study will offer some useful recommendations to ensure that children and youth can realize their rights to be educated, protected, healthy, and empowered. COVID-19 is a health crisis, but the ripple effect on children's learning, mental health, and safety cannot be ignored. In times of crisis, schools are often the first public service to be suspended and the last to be resumed. 1 year into the pandemic, nearly 1 billion learners are still out of school. That's in addition to the 75 million children and youth who were already out of school in crisis-affected countries. Numbers of this magnitude require an urgent and innovative response. COVID-19 has exacerbated the already precarious circumstances faced by children who are living in conflict and crisis, putting them at greater risk of illness, child labor, violence, and other forms of exploitation. When children and young people are out of school, their mental health, learning, and development also suffers. Without an education in a safe and nurturing learning environment, children and young people lose a sense of belonging and are denied the opportunity to acquire the knowledge and skills they need to reach their full potential. This is particularly true for girls. Drawing on our 20 years of experience, Right to Play has been taking action to keep children healthy and safe, learning and mentally strong. In 2020, Right to Play was actually able to expand our reach by adapting our programs to ensure more children could continue their education at home and receive mental health and psychosocial support to deal with the stress of the pandemic as well as other overlapping crises. In Mali, Right to Play is working to protect children as political unrest and poverty converge with the pandemic. Mali is one of the poorest countries in the world. Child labor is pervasive. 1 out of every 3 children in Mali work instead of going to school. With funding from Global Affairs Canada, our Jam Suka project has been working with families and communities to help children escape from child labor and go back to school. We have seen amazing progress in primary education completion rates, but this year's instability has threatened to undo much of that good work. Our team responded by supporting teachers to move to digital and radio platforms to ensure the continuity of education. We also helped to establish safe online support networks. This allowed children to keep in touch with friends and teachers, as well as have a safe way to report abuse or seek mental health support if needed. Lebanon is another example of a country reeling from concurrent crises, including the destruction of homes and schools caused by the Beirut blast in August 2020. Even before that explosion, over 50% of Lebanese children and adolescents suffered from anxiety. In times of crisis, supporting children's mental health is the first step to recovery. Play-based methods are found to be highly effective in helping children cope from shock and trauma. Without safety and well-being, children are not able to learn, develop, and thrive. Teachers must be equipped to provide this support to children by fostering supportive and playful learning environments. Taken together, education and mental health support can promote well-being and resiliency, critical thinking, conflict resolution, and community building. These skills are vital for all children and youth, but particularly those living in settings disrupted by conflict or disasters. There's much more to say on this topic, but I want to leave you with 3 recommendations. The first is that in times of crisis, children's learning and mental health must be prioritized. This means raising the bar on quality education by ensuring the holistic skills in mental health and psychosocial support are integrated into playful and conflict-sensitive curriculum and teaching practices. Secondly, Canada must immediately increase our cross-sectoral support to prevent and respond to gender-based violence, strengthen child protection systems, and improve mental health and psychosocial support. And finally, and of course, none of the above interventions can be successful without adequate and timely funding. We encourage Canada to deliver on its commitment to increase the international assistance envelope. The world's most vulnerable children are counting on us. I thank you.
Thank you very much, Ms. McIsaac. We will now go to our first round of questions consisting of 6-minute segments, and the first of them goes to Mr. Diot. The floor is yours for 6 minutes.
Thank you, and thanks for all of you being here. You do great work. I just wanted to start with a very broad question, and it's kind of the basis for all of these questions, I guess. You see survey after survey that says that most Canadians are, the majority of Canadians see foreign aid as very low on the totem pole, especially now with COVID. And indeed, many would say we should be spending less money because we're tight for money right now. So starting from, the first speaker, I'm wondering if you could tell me what you would tell somebody who believes that, and how would you tell them that that is money that would be a benefit to everybody in the world? Like I say, it's a fairly broad question, but I'd like your input on that.
Maybe I can start. So thank you for that excellent question. In this time of crisis, more than ever, Canadians actually understand what it means to have.
Mr. Chair.
To your mouth as possible. I think there are still some challenges with interpretation that would be helpful. Merci beaucoup.
Okay, thank you. I'll try to speak closer to the mic. Thank you for that excellent question. So it is true that during this time of COVID crisis, I think Canadians more than ever understand how the world is connected. Someone is unsafe, our shore. Canadians are also seeing what it means to have kids at home, which we talk about in international development, but many of these issues are right now playing in our own backyard. And that sense of connectivity and interconnectedness, that no one is safe unless everyone is safe, I think Canadians are understanding it much more before. So I think COVID, in a way, is showing us that interconnectedness to all around the world. And people, especially Canadians, more interested to know more about what the results of work overseas are happening, understanding where the aid money is going, understanding the results. So I think it's also a great opportunity for organizations like us, Plan International Canada, and many around my counterparts here to showcase the work we are doing and what major impact is bringing around the world, especially for those who are poor and marginalized.
Ms. Brosette?
Thank you. I agree wholeheartedly with Ms. Mirza's comments. I think what this pandemic has done is really brought a strong realization to the impact of a change in circumstances, such as, having schools closed in our own countries, having schools closed in Canada, and what that's meant for a lot of people in this country, and reflecting that on the impact that COVID has on people who are also living through displacement, living through humanitarian crises, and so helping and encouraging people to understand the double impact, the dual suffering that is COVID plus the humanitarian displacement, the humanitarian crises that these populations are living through is extremely important to help them to understand the importance of Canada's place also within the global humanitarian community, and the influence and the leadership that Canada can play in directing how humanitarian crises and humanitarian contexts need the support to protect children in such a situation as a global pandemic. Thank you.
Ms. McIsaac, you heard the question, obviously, right?
I did hear the question, and I would say I agree with both of the previous speakers. A couple of quick comments. One, we're more connected globally now than we have ever been because of this, and I do think people are acutely aware of what is happening around the world. I think also people are feeling the impact of this themselves much more broadly than the health impact, the impact on education and mental health as well. And so I think there's an understanding of what is happening globally and the importance of it. I also think Canadian values are such that we have a caring for the world's most vulnerable people, and I think a responsibility. As difficult as this pandemic has been in the global north, it is exacerbated in the global south and in developing countries. So it's very important to a lot of people. And I find when we reached out at the beginning of the pandemic and throughout, we saw our donations going up. People really understood the impact of this and wanted to help.
That's interesting because I still find it curious why people then, polls don't lie. I mean, they say, well, no, this is not the time to be looking at it, but it's kind of encouraging that you're seeing your giving going up, which is interesting. You talked, Ms. McIsaac, about $1 billion out of school due to COVID. On top of due to COVID, on top of the $1 billion that are already out of school in Africa. What can be done about that? That is a huge problem. I mean, we all know that probably it's very simply that schools are closed, like many are in other parts of the world, but is there any particular thing that can be done to tackle that massive problem?
Mr. Diot, that's your time, but I'll allow just a really brief answer if that's possible.
Actually, I'm going to ask my colleague Elias, who has joined us, to jump in because he is runs our programming. Elias, do you want to jump in?
Yeah, sure, and I'll be really quick on this. So it requires nimbleness on the part of organizations to be able to adapt their programming, to engage not just teachers in education, but to also look at engaging parents as well, because a lot of the learning is going to happen inside the home, and that's your access point to be able to impact that learning. And I think on your previous question, just really quick, as somebody who was born in Lebanon but lived in Canada for 16 years and then moved back to Lebanon, I think it's very important that we maintain the Canadian values of actually reaching out to other countries and helping other countries and recognizing the interconnectedness that exists in the world today. And I think COVID has highlighted that in a major way. Thank you.
We'll have to leave it there. I'm sorry, these are very tightly timed allocations. We'll now go to Mr. Fonseca for 6 minutes, please.
Well, thank you, Chair, and thank you to the witnesses and for your testimony. It is, when we look at how monumental an impact COVID-19 has had on the world, we look at Canada and we've seen that where we have our gaps and where but we've got all these public institutions, levels of government. NGOs, et cetera, everybody really working together to be able to address this crisis, this pandemic, and so when I look at Canada, then what I'm asking of the three witnesses is to give us some insight, give us a glimpse into when we go to these conflict, fragile countries that where so many displaced people, where children are finding it difficult to get an education, to go to school, etc., and where you may not have really any control over those institutions or lack of, be it their education system, healthcare system, government, what's happening, if testing, et cetera, everything that's happened here that may not be happening in other places. I am going to ask the three of you, the three that are presenting, give us a global scan as to how you've reallocated or what you've done with your resources to address kind of how you can have the greatest impact on the ground. I heard a little from Ms. McIsaac in terms of what you're doing in Mali, but what I'm asking now is of the three witnesses to take us right onto the ground. What are you doing with those dollars? How have you reprioritized to address COVID-19, where you may not be able to even get into some of these places? We can start with Ms. Brusati.
Thank you so much for your question. So COVID was a shock and an opportunity for us to rethink all our programming, the way we design our programs and the way we implement them. It required very, very quick adaptations. We lost the opportunity to, obviously, schools, as we all know. But with schools came also the loss of contact with children, the ability to identify children that needed support, the ability to for us to work to bring children together for psychosocial support, for mental health services. The way the IRC has adapted its programming is very much working through, as one of our colleagues said, working through parents and through caregivers, and using parents and caregivers to provide support to their children. We provided social and emotional learning packs to parents and provided support through different countries in different ways, through radio, through community focal points, through local organizations and the local partners that we've always been working with that had the foot on the ground to really provide that support to the caregivers within the home. We also worked through community focal points to identify children who needed support. There are certain services which we've strongly advocated that even with the containment measures are life-saving services such as case management and child protection services and must continue despite the containment measures. And so it was a question of how do we provide those services in the household to the child directly while protecting both our staff and the child and the family that they are with. And so really adapting those our approaches to ensure that we respect the containment measures, but also continue to reach the children that are most in need.
Oh, thanks, Ms. Rosati. Ms. McIsaac, I know that the Right to Play has a big focus on physical education, which improves mental health, et cetera. Ms. McIsaac, I would like to hear from you kind of on the ground, and because of COVID and the restrictions, et cetera, how have you been able to adapt to that? And maybe we can have Mr. Ayub from Lebanon tell us a little bit about how it's really happening on the ground, what you've had to change, how you've had to adapt to this steep learning curve.
Sure, thank you. I am actually going to turn it to Elias. I'll just say that we had to immediately make all kinds of adjustments to reflect the current context and the new reality. But he's living it there in Lebanon and also works closely with our colleagues across Africa and the Middle East. So Elias, do you mind offering some tangibility?
Definitely, and I think it builds upon a previous response as well in terms of being able to provide that support and that aid directly into the household. And I think we work in a variety of different contexts. So, for example, in Tanzania, we relied on radio in a big way to be able to disseminate the messages required from a health perspective. We even used pickup trucks and speakers on them, and had one of our coaches with a microphone drive around the village and be able to also disseminate positive health messages. In Lebanon, where tech was possible, is more possible, we did rely on different platforms through technology to be able to also reach the children and their parents. In Jordan, we worked in education, actually, videos around physical education, like you mentioned, and we were able to actually do all children inside Jordan. So there's a variety of different things on the context, and they're not always easy, but we've managed to respond in a good way.
Thank you very much, Mr. Fonseca. That's your time. Thank you, Mr. Ayoub. Monsieur Bergeron, la tour est à vous maintenant pour 6 minutes.
Merci beaucoup, Monsieur le Président.
Thank you. Once again, I'd like to thank our witnesses. Thank them for their testimony. And this is very enlightening with regards to the study that we're doing. And also, I'd like to thank them for the work that they're doing with these vulnerable populations throughout the world. We've discussed education, access to safe drinking water, health care. All of these are, as someone said, these issues existed pre-pandemic, but they've been exacerbated with the pandemic. One of the things that we were discussing was the difficulty in having youth in conflict zones go to school, and that this has been exacerbated by the pandemic. And we have the same situation here, and somebody was highlighting it. Even here, there's a level of disinterest with regards to our students and their studies and linked to virtual learning. And these conditions, well, the level of disinterest must be even higher in these conflict zones. I imagine that before the pandemic, youth were having to participate in the workforce, or maybe were victims of human trafficking. We can imagine that the pandemic once again will have exacerbated all of this. Mrs. McIsaac was talking about the situation in Mali. So how do we deal with school closures, the disinterest of youth with regards to school given the pandemic, and difficult conditions that are being imposed, and the reflex to go work, and then to be eventually perhaps caught in human trafficking networks?
Merci beaucoup pour la question.
Thank you.
Thank you very much for the question.
So much for your question. Yes, I mean, the COVID pandemic has taken us back, and I think we need to, we have many programs that have been working for years to get children into school, children that are out of school back into school, and really support that reintegration into education. We've looked at, and there are lots of options that we can look at to generate that interest in returning to school and work to address the social norms around education, especially for girls, but for children in general. And I think in a situation like this, it also needs to be coupled with work to support family livelihoods, where families have either lost their livelihoods completely and are relying on their children's labor and the work that the children are doing, or are subsidizing the reduced livelihoods with their children's work. And so looking at a holistic approach where we're supporting the family in increasing and supporting them in their livelihoods and in their opportunity to meet their basic needs, while also addressing and supporting the reintegration into school, looking at accelerated learning programs and other support, including in non-formal education opportunities for children that may have been out of school for a very long time and need that additional support to be able to reintegrate into the formal education system. Thank you.
Je sais pas si d'autres témoins veulent
I don't know if anyone else wants to comment.
Quick add-on, one of the things that we did do immediately when the pandemic started and we realized we'd be teaching remotely or working with teachers remotely was to move to lots of different approaches that were more interactive, peer-based, looking for ways through technology, but also with whatever materials available to engage children in as interactive type of learning as possible. So, we're always focused on play-based, child-centered learning. This took it to the next level because we understood that the children would become disengaged. And so this became a priority for us to make it as engaging as possible. I think it's a great point you've made, sir.
Yeah, maybe
merci.
I can.
Yes.
Great points that were raised. One of them is the old-fashioned radio came in very handy in West Africa. So many of our programs, whether they're in Mali or whether they're in Senegal, Burkina Faso, Northern Nigeria, the radio is very popular there, and we have used radio a lot. And in places where I think Mr. Ayub also mentioned, like in Jordan refugee camps, we have used e-tablets where the connectivity is better. So each country, we have tried to use context-specific education support, not only for the families, but the teachers. And one important point to realize in mobilizing the community is using the religious elders, traditional healers, the grandmothers. I think these are social influencers. When you start talking to them and involving them in the programs, they have a tremendous impact in making sure the children are not left out of school. And I'm a refugee myself, growing up as a child and having gone to school and gone through exactly these kind of accelerated learning program myself years ago. It's so important to keep the children, especially girls, at school, because once you lose that generation, that learning window is small. If you lose it, you can't get it back. But Plan International Canada and many of our colleagues that have mentioned, we do this in and out for years in many, many countries, and Plan is responding in over 50 countries. So we already have local partners, thousands of volunteers who are part of the communities. They know how to navigate it better. So I think that outreach and the presence we already had global has served us very well during COVID, because you can make pivots in each country, in each context differently.
Thank you. Merci beaucoup, Monsieur Bergeron. Merci. And the final questioner in the first round, Ms. McPherson, for 6 minutes, please.
Thank you very much, Mr. Chair. And I just want to start actually by just commenting on a comment that was made by one of my colleagues about how Canadians are not supportive of international development and contributions to that. As someone who's worked in the sector for most of my career, I'd just like to say that I believe Canadians are much further ahead than government in terms of their support. And I would encourage all of the panelists who've joined us today to send in those polls I know that we all have access to that show the huge support Canadians feel for international development and our commitment there. The first question I have, we've heard so much about the impacts of COVID-19, and I think it's been very, very clearly articulated that the biggest impacts have been on girls, on displaced populations, on refugee populations, but also predominantly on girls. So I'd like to ask Ms. Mirza if she could talk a little bit about how Plan is adapting the field programs for girls because of COVID-19.
Yeah, so we had to pivot, like many of my colleagues who mentioned it earlier, very quickly within pandemic. And that was, I think, where NGOs' agility really worked, because within months, we were able to change and pivot all our programs. For the girls, the biggest one we were focusing, and we continue to focus, is on keeping the girls in school, whether it's in remote learning, whether it's through radios, as we talked about, and all kind of mechanism, because We know if girls stay in school, the likelihood of them getting married early will be reduced. And already in the pandemic, we are seeing a huge increase, a suspected increase in a rise of early forced marriage. So keeping girls in school was a big one. Distant learning was possible in some countries, such as in Ghana. We had remote learning in northern Ghana, but it's not always possible in all contexts. Internet connectivity is not equal around the world. So you have to be very context positive, and it was not available in all places. The other second program that we focused a lot for girls, especially adolescent girls who often tend to be forgotten, is the access to comprehensive sexual and reproductive health services. With COVID pressure, these health system in developing and especially in fragile contexts, the health system is poor as it is. With COVID, this sexual and reproductive health services were almost forgotten. So there's the necessity to continue access to those services, training the frontline health workers, providing PPE, making sure there's understanding about the need of this disease, and raising awareness in the community as well as in the family about the COVID. That was a huge task in the first few months. The third one that I wanted to highlight is on the food security. We are seeing huge surge in food, lack of food in many parts of the world. And it's interesting, it's not because of the COVID in that communities, but it's because of the supply chain and the connectivity all around the world. It has created huge challenges and making sure, so we are providing a lot of special food services, food assistance through vouchers, cash program, and making sure women and girls are getting those. So those are some of the quick examples around the world to making sure the girls are kept safe and at home. Because again, as we heard earlier, the rise in gender-based violence at home. So home is the place they were, yet they were not always as safe as we would like to be. So ensuring those kind of services and awareness is available for girls, especially adolescent girls, is a big priority and continues to remain so. Thank you.
Thank you. And thank you for all of the work that PLAN does on behalf of women and girls around the world. It's very important. I'd like to just give the opportunity to Ms. McIsaac to talk a little bit about how Right to Play International has also been able to pivot their work during COVID, and just, to talk a little bit about the proportion of displaced children and those living in conflict situations and the access that they've had to education while schools were closed.
Thank you. We did a lot of work initially to pivot to just literally in terms of focusing in on hygiene, keeping kids learning, and remote learning, and psychosocial support. We knew instantly that there was going to be need for children to have real mental health supports. And so a lot of the programming efforts went into that remote learning and ensuring that children had that support. Elias, I'm actually gonna call on you because I feel compelled to bring him into these because he is such a leader in our program area. Do you wanna touch on a few things that we've done?
Yeah, thank you, Susan. And I think there was a post also around working with youth in some of the countries that we're in, and especially when you're talking about youth refugees and youth that are impacted by crises. Often dealing, even prior to COVID, actually, with an issue that's lack of hope. A lot of youth around the world are finding it very difficult to think about what their future holds, and I think what COVID has done, it's exacerbated that feeling also among youth and among children in a lot of the countries that we operate. And what we've tried to do remotely, what we've tried to do and adapt through our programs is to actually provide more opportunities for youth to be leaders and be solution oriented and to provide solutions to the many issues in their communities. And I think just from the small sample that we've seen in many of the countries that we're working in, we've seen a lot of positive results from youth-led initiatives and the work of youth in contributing to solving their own issues. And I think that's a very positive development, and we hope in the future. Thank you.
Thank you very much for your work.
Thank you, Ms. McPherson. Thanks very much. That takes us to the end of our first round. We have very little time left, scheduled time with our witnesses. What I propose to do for the second round is that we take the remaining time and simply divide it equally to give each party, each member representing an official party a chance to ask a question of 2 minutes, 1 minute for a question, 1 minute for an answer. I have 4 speakers lined up, Mr. Chung, Ms. Sachs, Mr. Bergeron, and Ms. McPherson. So with your consent, let's proceed that way to take advantage of the remaining 10 minutes. Mr. Chung.
Actually, I'll be filling in. Oh,
Mr. Diot. Okay, my apologies, sir.
Yeah.
Please.
All right. Yeah, I'll keep it fairly brief. Ms. Mirza, you talked about gender-based violence and gender-based issues. So I'm wondering what the special challenges are in dealing with when you have many societies that might not see genders as equal. For instance, some societies will say, well, why should you send a girl to school? What are the special challenges there, and what can be done about that?
It's a great question. So interestingly, I think everywhere people do want to send their children to school. So there are barriers that remain, especially for girls, but for all children, but more so for girls. Just raising awareness about the importance of education has been a tremendous work. We use not only this whole gender integration is not just about targeting girls. We have focused heavily in Plan International on male engagement, raising awareness with traditional elders who often tend to be men, father figures, spouses, grandfathers. They have tremendous power and decision making at home. So when we want to talk about raising awareness, it's not just at household level, but also at the community level with religious leaders, traditional elders, and at the policy level. Oftentimes, the education policies are not very supportive. So let's say in some countries, when girls get pregnant or are married, they're not allowed back in school. So making sure that the policy level, those barriers are removed is also important. So it's almost like a multi-layered, multi-pronged approach that you need for keeping all children in school, but more especially for girls.
Okay, thanks very much. And I see we're fairly tight on time, so that would be it for me. Thank you.
Appreciate that. Thank you very much, Mr. Diot. Ms. Sachs.
Thank you, Mr. Chair, and thank you to all of our witnesses who have taken time today. The work that you do is absolutely incredible, and I really appreciate the time we're taking in this session to really talk about mental health and the important aspects of that. Ms. Brusati, I'm fascinated with the work of IRC, specifically with the Sesame Workshop program. I see it as a unique opportunity to address intergenerational trauma as a result of conflict and how family dynamics impact early childhood learning. Could you share, I know we don't have a lot of time, just briefly, the impact of this absolutely incredible program?
Thank you. Yes. Yeah, the Sesame, our Sesame program has reached children across the Middle East, across the countries affected by the Syrian crisis in Iraq, Jordan, Lebanon, as well as within Syria itself, really working to support young children's mental health and well-being, as well as supporting and providing guidance to caregivers and to parents around how to work with their children, how to play with their children, how to interact with their children, and really encourage that nurturing care and that nurturing kind of relationship between caregivers and children. I don't have exact statistics in relation to the specific impact that this program is having. I don't have the actual numbers that we've reached, but I'd be happy to provide and to share those numbers after today's discussion. Thank you.
Brilliant. Thank you very much, Ms. Sachs. Monsieur Bergeron.
Merci, Monsieur le Président.
Thank you, Mrs. Berzotti. In the answer to my preceding question, you spoke about satisfying basic needs of families, and assuredly, access to food is part of this, but in some conflict zones, I'm thinking about Yemen, there's a situation of extreme food insecurity. So in conflict zones, in your opinion, and other witnesses, if there's enough time, how did the COVID-19 crisis accentuate the food supply in conflict zones?
Merci beaucoup. I think yes, COVID has exacerbated meeting basic needs and families' ability to provide nutrition for their children. We've carried out several simple assessments through our teams and through child protection focal points that we have in countries, and have seen that child neglect and child labor are two of the top child protection priorities that have come out as far as exacerbated by the COVID pandemic. And when we look at child neglect, that's very much linked both to the fact that parents and caregivers need to continue going out to work, but are leaving their children on their own, as well as not being able to provide sufficiently for their children, including from a nutritional perspective. And the child labor is also has also increased exponentially, in part because children are at home, and so parents often take their children with them to work, as well as the more kind of exploitative labor that we've seen children falling into. Thank you. I think.
Thank you very much. Merci beaucoup, Monsieur Bergeron. Thank you, Ms. Brusati. And finally, Ms. McPherson, it is your turn for another 2 minutes.
Thank you. And I'll try to be as very quick as I can. Ms. Brusati, thank you for your work, but you spoke today about how displaced children have always suffered from school closures, they've always suffered from increased risks of violence, and that COVID has deeply increased these impacts. But you also spoke of the multi-trillion cost to not having children in school. And I'm delighted and excited about the Together for Learning campaign that will look at refugee and displaced children, but is there anything else that we need to know about the impacts on children if we don't act with the necessary urgency, and maybe the potential gains if we do act decisively and adequately? Sorry, it's very quick.
No, that's fine. Thank you so much for your question. I think, as IRC, we had a big, we did a really strong kind of campaign at the beginning of the COVID pandemic around the shadow pandemic of violence that we're seeing as a direct result of the containment measures. And what that shadow pandemic of violence, and when we talk about violence, it's violence against children within the home, increase in GBV, and what we're seeing is a reduction in the gains that we've made since the Millennium Development Goals and the SDGs as well. And so what we need to look at is, if we do not invest in protection services, in support services, in education services for these children, the result is going to be countries are going to be we're going to lose the investments that we made through the Millennium Development Goals and the SDGs. We're going to be going back 20, 30 years to the gains that we've made, and all the investments that we've made in the last 20 and 30 years are going to be seen going backwards. And I mean, it's impossible to quantify the loss that means for both the children of today, but also kind of the future economically for our countries, as well as the countries where we're working and the conflict settings where we work.
Thank you very much. Thank you, Ms. McPherson. And on our collective behalf, colleagues, I'd like to thank the witnesses for their appearance today, for their testimony, for their expertise, and for their incredible service. We all would have liked to have had more time with you, but it was extremely useful. Merci beaucoup. J'aimerais également remercier.
I would like to thank our interpreters as well. I would like to thank them for their great work, especially given some of the sound challenges we experienced. So thank you very much.
Enjoy your evening. Keep safe. We stand adjourned until our next session. Merci beaucoup.
Thank you.
Thank you very much.
Thank you very much.